Hello friends, today I am going to discuss question number 9 of Katherine Anderson mrcog 1. This question is related to pudendal canal and its content. So the content of these videos are pudendal canal, pudendal nerve and pudendal neuralgia. We will discuss this question at the end of the video. Now pudendal canal. Pudendal canal is also known as Alcock's canal, is a sheath derived from the fascia of the obturator internus muscle and is found in the lower lateral wall of the ischiorrectal fossa. Now, gross anatomy. The pudendal canal lies on the medial surface of the obturator internus muscle and the medial aspect of the ischial tuberosity above the falciform ridge. Now this diagram shows pudendal canal, which is basically formed from the fascia of obturator internus muscle, and it lies medial to the obturator internus muscle and the ischial tuberosity. Contents are: it transmits the pudendal nerve with internal pudendal artery and vein from the lesser sciatic foramen posteriorly to the deep perineal pouch interiorly. This diagram shows pudendal canal with its content. Now pudendal nerve. The root values are S2, S3 and S4. The pudendal nerve supplies skin, organs and muscles of the perineum. Therefore, it is in charge of micturition, defecation, erection, ejaculation and in the female parturition. As this nerve is important, so I will briefly discuss it here. In this diagram you can see origin and root of the pudendal nerve. After arising from S2, S3 and S4, the pudendal nerve leaves the pelvis by leaving the greater sciatic foramen. It re-enters into the pelvis after entering into the lesser sciatic foramen, and after that the pudendal nerves enter into the pudendal canal. In the pudendal canal, pudendal nerves give rectal branch of the pudendal nerve and superficial perineal branch. After leaving the pudendal canal, pudendal nerve gives dorsal branch and deep perineal branch. The pudendal nerve has a great chances of compression when it passes through the pudendal canal, and also at the ischial spine, a pudendal nerve block is given. Now the pudendal nerve divided into three main branches: the rectal, the perineal and the dorsal clitoral or penile branch. The rectal branch supplies sensation to the skin in the area of the anus and motor control to the external sphincter. The perineal branch divides and supplies the labia and vulva, as well as the outer third of the vagina in women. It supplies many of the muscles in the base of the pelvis. The dorsal branch gives sensation to the clitoris and its hood, or the back of the penis or glans in men. The dorsal branch also gives motor power to the sphincters that are part of the bladder control and the ejaculatory mechanism. Now in this picture you can see sensory innervation of the pudendal nerve as shown in light green color. Now pudendal nerve entrapment syndrome or pudendal neuralgia. Pudendal nerve entrapment can occur when the pudendal nerve is compressed while it passes through the pudendal canal, also called cyclist syndrome, as mostly occur in cyclists, but this pain is not exclusive to cyclists and can arise from a variety of other sports and activities, including weightlifting. Cycling is thought to compress the nerve, whereas weightlifting demands considerable support from the pelvic floor muscles. In a full squat, the pelvic floor muscles are stretched and may result in a tension mechanism causing injury to the nerve. Childbirth also poses a risk to the nerve, especially when a large baby or a delivery needing forceps or vacuum. Pelvic surgery very occasionally causes injury to one of its branches, as can direct trauma to the pelvis. So what are the signs and symptoms of pudendal nerve injury? Pain in the pudendal nerve area, which may be superficial or deep in the anus, vagina or vulva, scrotum or penis to the tip of the urethra. The pain is worse with sitting since the nerve is less mobile and so is more vulnerable to compression. Pain after ejaculation or bowel movements from tight local muscles. Pain worsening through the day. Sense of a foreign body in the rectum or vagina. Pain predominantly on one side. Excusate tenderness with internal examination of the opening of the pudendal canal. Now treatment, physical therapy, medication, lifestyle changes or surgery are possible treatments for pudendal neuralgia. Provider may combine treatments for quicker relief from symptoms. Now the question is, pudendal canal contains the pudendal nerve, artery, vein. It's true. The pudendal nerve is not located in the pudendal canal. It is false. Runs superiorly to the sacrotuberous ligament. It is true. Runs laterally to the obturator internus. It is false because pudendal canal runs medial to the obturator internus and passes medial to the ischial spines. It is also false because pudendal canal passes lateral to the ischial spine. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.